Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. The movie's gonna make me a big star, 'cause I can play the part so well.
You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe. Yesterday, I returned from California where I met my extended family. My 74-year-old cousin was remarrying after having been a bachelor for about 45 years. And it was good to see everybody. Obviously, very different environment than concrete Dallas. This was on the coast just south of San Francisco. And then there's also a very big political difference between Dallas and South Central California, but was still very enjoyable. One of the things that struck me, we had great airline service. It was nice to be able to move on time. But one of the things that struck me was sitting over the airline wings. I was looking at the wings and kind of marveling at the whole idea of lift and Bernoulli's principle, and started thinking about some of my classes in physics. And I remember one of the test questions was to ask us to calculate the force of lift on aircraft wings and how that changes when the wings start to wobble during turbulence. And flying has never bothered me until college physics, when I had to actually sit down and calculate how much force is on the wings and how those forces are transmitted and how the change in the shape of the wings during turbulence changes the amount of lift they have. And then for about the next 2 or 3 years, I did not like flying. But it is amazing how it all puts together and it all works. And I was explaining to a 75-year-old patient this afternoon that, look, what you're wanting me to do mechanically is about as amazing as wings being able to lift an airplane, because you, at this stage in life, have a 45-degree spinal curve that's going to be very difficult to correct, in part because of the biomechanics of the spine. The shape of the spine has changed over the decades that he's had this curve. And so for me to go in one afternoon, drill holes in the spine and try to change the shape of the bones so that, like the airline wings can be flat, is a technically difficult endeavor. It's the kind of thing that can be done, but the question is, what are the risks? And at age 75, kind of in the last lap of life, does your body really have the capacity to do that healing? So that was hard news for him to take, because he wants to be able to go walk around the block, walk 30 minutes, but right now he's having trouble just walking around the house. But the mechanics are such that some of these things just can't really be done reliably. We talked about it, and never mind there's the risks of the heart attack, strokes, blood clots in the arms, blood clots in the legs, and infection. It's just the spinal anatomy he has a twist to it. So it's a right to left rotation as well as a right to left bending. And that kind of bending does require a reshaping of the bone. It does require metal inserts, metal rods to be put in the spine. As a matter of fact, part of our training, we spent, I think it was about 3 months, just studying metallurgy, studying iron, studying steel, what makes steel, and how you transform iron to steel, and then what the various different alloys do in the steel, or the various different elements do in the steel to make an alloy, such as magnesium or manganese or phosphorus or nickel. Those can all be put together to change the bending properties of the steel. And we all kind of think of bone as being hard, like rocks, and maybe even imagine it as being dead, static, doesn't change. But in reality, bone is living tissue, just like muscle, just like skin. And so bone does change its shape over the years depending on how your spine is being used. So for people who are sitting most of their life, their spine tends to kind of bend more forward. For those who are athletic, they tend to maintain a better posture, and there's many reasons for this. But that's part of what has to be corrected. So when you go to start to change the shape of bones, one wants to use a specific metal that is similar to the flexibility of the bones. The engineers call this the modulus of elasticity. What we all know it is the flexibility of the bone, modulus of elasticity. So we have to pick a metal that will match the modulus of the patient's bone. There are a half dozen commercially available metals, but for a variety of reasons, there's really only 2 or 3 that are readily available. The common ones are the stainless steel, and then the other ones are the titanium alloys, because those titanium alloys match the flexibility of the spine. So I went through this with this older gentleman, and I said, look, if you really want to have this done, I can't do it all in one day. It's just going to be too much on your body. We will go in and unpinch the nerves one day, then wait 6 weeks, maybe up to 12 weeks, and then come back for a reshaping of his spine and correcting his curvature. And that's where, again, have to think about which metal do I want to use to be able to adjust his bones, because those bones have softened a little bit. And then that brings in the whole idea of 3D printing to have metal devices made. And then, in all fairness, it's the kind of thing that insurance is going to cover. So those are some of the things that I consider every day. And since we're talking about metallurgy, while at the wedding, which turned out to be a long affair, I started thinking about how I want to weld together some planters outside for a vegetable garden, because my soils are very heavy clay. And so I researched that back in 1933, U.S. Steel developed a steel alloy, which they then marketed as Corten. And Corten is iron plus phosphorus plus magnesium, and I think it may have manganese in it also, but it rusts in a certain way that train cars rust. And that outer rust becomes a very hard coating to the metal. And so that's why railroad cars last forever. That's why bridges last forever, because U.S. Steel made a lot of the steel for the bridges, and that's where my planters are going to, that's why I'm going to make these planters so they last for my kids. I'll weld those together. And that kind of metallurgy also ties into, again, the metallurgy that's used in the spine, whether we are using a artificial disc that has a certain elasticity and flexibility, or whether we're using metal rods and screws along the spine that have a certain elasticity or flexibility and the ability to turn it. So hopefully this gentleman will make the decision whether the risks are worth it for the benefit of being able to walk, and then he'll call me and we'll figure out what we're going to do. You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe. As I was talking to this patient, we were discussing the correction of their curve. So this is the skeleton seen from behind, from my perspective. From your perspective, it's in front. And from this view, it ought to be straight as the metal rod behind it. It obviously has an S-shaped curve, and that S-shaped curve is scoliosis. The scoliosis is a bending of the spine, but because the spinal cord is inside the spine itself, When the spine becomes bent, it then bends the spinal cord, and if it bends it enough, it'll cause a spinal cord injury. And so a bent spinal cord in this area will produce weakness of the legs or the bladder, and that shows up in walking, but more commonly it shows up as a person goes to stand from a chair or tries to get off a toilet or in and out of a vehicle, because that's when we use those muscles of the pelvis that are supplied by the spinal nerves. Injury to the spinal cord will be a permanent weakness, which is different than injuring the nerves, what we call the peripheral nerves, in the lower part of your spine and around your pelvis, or the peripheral nerves that come out of the neck and go into the arm. Those nerves can recover if the pinching is removed from those nerves. There's many people I see tell me, Doc, their shoulder hurts, but as you start to talk to them and examine them and ask them the kind of questions that a professional like myself can do, you realize it's not quite the shoulder. It's really coming out of the neck. It's hurting the muscles and nerves that are shared between the neck and the shoulder. And one of those nerves is the spinal accessory nerve. And the spinal accessory nerve is not a nerve that's commonly pinched, but when it is pinched, it can hurt quite a bit, and it also can be very difficult to detect because it does not go like all the other nerves coming from the spinal cord. It comes directly off the brain, but that's another subject for another day. But the spinal accessory nerve is another nerve that can go haywire and cause all kinds of problems. But again, in discussing the matter with this and other patients, I and my colleagues can pretty well straighten any curved spine we're given. There's obviously exceptions, but we can do it. You're basically just taking a metal rod, and as we were talking about earlier, it's either stainless steel, which is only used now in very rare situations, or one of the titanium alloys. The problem we get into is there are major blood vessels along the spine. And so in straightening the spine or twisting the spine, one also has to straighten or twist the blood vessels. And blood vessels that are used to being bent for 75 years, when they're straightened, they crack, they split, they start to leak, they develop blood clots and all kinds of problems. So it's not really just the bone, but it's also the blood vessels that go with it. Interestingly enough, there is another artery actually inside the spinal cord that doesn't receive the amount of attention it probably should. Because earlier I was talking about the blood vessels that go on the outside of the spine, but the artery that is right in the center of the spinal cord, right in the middle, that supplies blood to the spinal cord, can also be pinched in the process of straightening or rotating the vertebra. And in layman's terms, people then develop a spinal stroke. So remember that the brain and the spinal cord are really kind of one piece. And just like people have strokes in the brain and it leaves them with facial weakness or half their body weak, a person can have a stroke inside the spinal cord and also then leaves half the body weak. So those are the kinds of things we try to avoid, obviously, and those are the considerations in straightening. And so as I told the man I saw earlier today, I wish you were 45 years old, or if you'd had this done 15 years ago before certain things happen with the aging process, I think you'd have a better result. But at the end of the day, you're 75 and we can't change that. So these are the kinds of things I can do to help. And if we're going to do the big surgery, we're going to do it in stages. It may take 3 different operations, again, spaced 4, 6, 12 weeks apart, depending on what all needs to be done. Thank you for watching the C-Spine Show. A new show is uploaded at 9 p.m. every Wednesday.
Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. The movie's gonna make me a big star, 'cause I can play the part